project on You Good, why well-being is relational. It's my privilege to be able to welcome you today to this session, one of 3 capacity development sessions. I'm joined with my colleagues today from the NRF, from the HSRC, and from Foundation Botnar, as well as Dr. Shreya Jha, who's the co-founder of the Relational Wellbeing Collaborative, and a You Good program advisory group member expert. And so welcome to you, Shreya. Really nice to have you with us. We're really looking forward to learning more about you and about your work. And we're just delighted to have so many people in the room. Colleagues, we know that you are here because you are very keen to get going on writing your full proposal. And what we had promised initially is that we wanted to make sure that by the time you started to write your full proposal, you felt prepared. When we met last month, or earlier this month actually, there were so many questions. There were questions about many of the technical aspects of writing the full proposal, and we have taken note of them. We are busy putting together the frequently asked questions. We are taking seriously all of your concerns, all of your questions. We want to make sure that you are as fully equipped as possible to write the best possible proposal that you can, because we think that this work is so important. The idea that well-being amongst young people in the Global South needs more than them just trying on their own to make things work. That for us is the kind of rationale and the reason why we think this program is important, and why we're so excited to have the funding from the Foundation Botnar and the support, and why the NRF and the HSRC are working together as closely as we are. Many of you have been involved in writing funding and grant proposals before, and you get the money and you start doing your research, and then at the end of 3 years or 5 years or ever how long, you produce a report and a book and an article. And we are trying to make this different. We are trying to learn from each other as we continue through these next few years. We are trying to make sure that we don't just compete with each other, but that we help and assist each other along the road, and that we put together what we hope will be something that young people will want to participate in, will benefit from, and that we will learn as researchers, as academics along the route. So welcome to today's session of capacity development. It's the first in 3 days. You may have seen on the program that it says the facilitator is Dr. Angelique Wilskut, my colleague, but I'm going to take today and kind of lead us through today. She will lead us through to tomorrow, and then one of our other colleagues will lead us through on Thursday. I'd also like to talk just for a few seconds about the rules of engagement. One of the things that we did when we met on the 18th of August earlier this month is we allowed everybody to ask all their questions all at once. We also allowed some people to get quite specific about the focus on the context or the problems that they were experiencing. And I'd like to ask, in the spirit of making sure that everybody has got equal airtime and that everybody's concerns and issues are addressed, that today we focus on the subject that we're talking about. And today's subject is really about the development of relational well-being as an approach. So we want to make sure that we've got an agreed and a group understanding of what relational well-being is from various perspectives. And we want to make sure that your questions are about that topic. So when we do have a chance for conversation, which we will have, we would really like to ask you to kind of there's a saying in English that says, stick to the knitting, right? Ask questions about this topic. There will be opportunity to ask general questions as we proceed over the days. And we're going to have some more sessions where we'll be able to ask more questions about some of the technical aspects of the program. I will introduce my colleagues as we move through the program some more. Tomorrow, just an overview of tomorrow, is we're going to be talking a little bit about the notion of theory testing. What does it mean to test the theory? And we've got a guest speaker tomorrow, Dr. Julian Eckel, And then one of our team, Dr. Candice Groenewald, will take us through some of the ways in which we are conceiving of evaluation within this project. And then on Thursday, we're going to look at young people's participation in the study, and we are going to be really looking and asking young people who we've got on our advisory group to come and help us to really investigate and interrogate that topic, so that it isn't just a tick box, but it's something that we really put our heart and soul into as we move forward and write these proposals. As I said last time that we met, you are here because you are through to the next round. And we have funding to fund probably 1 in 3, 1 in 4 of the projects that are put together. And we want to make sure that you have as much capacity in order to put together a really good proposal. Unfortunately, we're not going to be able to fund all of them. But we also hope that part of being part of this team will really help you take your work forward in other ways, even if it isn't funded through this Foundation Botnar NRF initiative. So without further ado, thank you all for introducing yourselves. I can see that we have people from Colombia, Bangalore, Tanzania, South Africa, I'm seeing institutions, I'm seeing Ecuador, hola, right? So I think I'm going to try and learn a bit more Spanish before the end of the study. And yeah, so good morning and good afternoon and good evening from Vietnam. I'm sure it's already evening. And yeah, so welcome to everybody. Colleagues, I'm going to ask that Dr. Shreya Jha addresses us. We've asked her to speak for around 30 to 40 minutes, but to kind of give us a real deep dive into understanding relational well-being as an approach. And then we're going to take some questions after that, directed at Shreya's presentation for clarity, for deepening an understanding. And then we'll go into a kind of a more application of it. And then we'll have another discussion where we can think through how it applies to your project that you are busy envisaging. So unless there are no other questions, Shreya, I'm going to ask you to take over. Please feel free to speak, to flight your slides if you have, and we really look forward to hearing from you. So thank you very much, Shreya.
Charlene, thank you, and Angelique and other colleagues from NRF and HSRC, thank you very much. I have a presentation which I will share, and yes, so I'll share my screen. I'm aware that people who are joining today's session may have also attended the session about a month ago, where also I presented on relational well-being. But I'm also aware that overall the concept may be new to some people, more familiar to others. I'm not sure is that visible, my screen? Okay, thanks.
Yes,
thanks.
visible.
Great. So I'm going to talk a little bit about the empirical and theoretical origins of relational well-being. So go back more into the history of how we came to the concept of relational well-being. So in today's session, I'm going to talk, as I said, what were the origins and the impetus for undertaking the research that led to relational well-being? So who is the subject of well-being and what is the subject of well-being? I'll talk a little bit more about the thinking. So relationality as a running theme. I'll talk about dimensions and domains and people as relational selves. And I'll talk about methods and concepts. The methods and concepts is something that will be interwoven through everything that I speak about. As I started to say just before I shared my screen, I recognize that many of you who are here today may have attended the seminar about a month ago, where also I spoke about relational well-being, but I spoke more about relationality only. There was also a slightly shorter presentation. I know that all of you are coming to this session from very varied perspectives. Some of you may have a social sciences background, some of you may not. And therefore, you will all have varying degrees of familiarity with relational well-being. What I hope that you will all go away with is some kind of a common understanding, if you like, a kind of common denominator, but perhaps not the lowest common denominator. So as I said, I know that you're all coming from different perspectives, different degrees of familiarity. I hope that we can all be on a similar page, if not quite the same page at the end of this. Because of that, I also know that some of you may be more or less familiar with these ideas. I think those of you who have backgrounds in sociology and particularly anthropology will be more familiar with some of these ideas, especially of relationality, and it may be newer to others. I will try and go a little slowly. I will also stop in between, and if there is something that at that particular moment seems unclear, you are welcome to put in a question or raise your hand, and perhaps I can take that question right away. Although there is a Q&A at the end, I also don't want to complicate matters for the people who are managing logistics. Anyway, so that's sort of an overview of today. And now let me move on. So the starting point of developing the relational well-being model. Also, just a word on the term relational well-being. Relational well-being is used as a term by many people in different ways. Sometimes it refers to well-being in the area of relationships. Often that is what it refers to. If you attended the seminar about a month ago, you will know that when we use the term relational, we're using it in many different ways, and it does a different job in the relational well-being model. But the term relational well-being as a model is something that has been given by Sarah White, my colleague, and myself. Anyway, so the starting points of relational well-being. To paraphrase a film that came out sometime last year, at the time that we started, the research on which our model is based, well-being seemed to be in everything, everywhere, and all at once. It was ubiquitous. It had really proliferated. Well-being, as we know, is centered on human subjectivity and experience. It's there very much in the everyday, and part of its appeal, maybe not part, but a great deal of its appeal lies in the sense of the positive that it gives. The idea of well-being seems to go beyond the material. It looks to experiences and it looks to connection. This is something that is tremendously appealing about it, but it is also diffused through products, not just through this idea of experiences and connection. I was always very amused many years ago when I read about a well-being aisle in a UK supermarket, and this idea that there was actually an aisle that could cater to the kind of products that would increase well-being. And sometimes they were health and wellness products or more nutritious food or something like that. So as you can see, this term is really diffused through everything. At the time that we were starting out, and I suspect still now as well, the term well-being has been conceptualized primarily in economics and psychology, in the sense that these are the two disciplines that have really developed a great deal of what sort of the terms and techniques of measurement and the ideas underpinning the concept. It's focused also a great deal on quantitative methods. This is, of course, important in policy terms, because policymakers seem to like measurement, or it certainly gives you measurement is seen as something that gives you hard data with which to develop policy. But quantitative methods also seem to have some purchase in measurement for the self. So, for example, the positive and negative affect scale talks about cultivating a positive affect. And somewhere where it's reviewed, it talks about how the more you practice positive affect, the more likely you will develop positive thinking. So there's a great deal about well-being that is tremendously appealing. Of course, another way of looking at it is to recognize that part of the reason that the term has proliferated to the degree that it has is also related to sort of worries or concerns regarding the decline of the social and relational in the current period. So these were the kinds of thoughts that led to us undertaking research on well-being. We began our research in 2010. Before that, we'd already done a pilot project in about 2009, and there'd been various different pieces of work that Sarah and I had both done preceding our joint research beginning 2009-10. We were very purposive in choosing to do our research in the Global South. And Wellbeing Pathways, which is a research project through which most of our thinking on relational well-being has developed, was a two-country research in rural India and in rural Zambia, lasting from 2010 to 2014. The kinds of things that we were thinking about at that point were, or the kinds of questions that were sort of at the forefront of our minds were about what was different about well-being in the Global South from or predominant approaches that were coming from the Global North, or what was similar. So, for example, what ideas or concepts of persons and selves underpinned these ideas of well-being? We were also keen on understanding the in-betweens. So we were concerned about binaries between ideas of, say, poor but happy. We were concerned about binaries between disciplines, and we were really keen on understanding that space in between these binaries. So ideas such as poor but happy, which underpinned a lot of thinking on well-being, that if you were happy, then you did not need material well-being, or material well-being was everything. These were all ideas that which we took to the field when we began our research. We were concerned, say, with questions on autonomy, this idea of an individual collective divide, which is something that's commonly thought of. What did it mean in well-being terms? What did it mean for people's lives? These were the kinds of things we were thinking of. Most of all, we were concerned with how people conceive of their own lives and what makes for a good life in various places in the Global South. And we were concerned with reflecting as closely as possible people's own descriptions of their lives. Does that seem to make sense so far? Yeah. Key findings from our research were, one, that people understand themselves essentially in relation to others. So the way that people talk about their lives is never just about themselves. When they talk about their own lives, they're always talking about both proximate and distant others in their lives. And I'll give you examples of what this means. And I think I said this last time as well, relationships make life meaningful for people, and they enable people to get by and get on. This is especially so when you think about low resource settings, and the fact that people deploy connections in order to, whether it's to get jobs, whether it's to get resources that can help them get on, that kind of thing. But relationality is also implicated in how people are doing economically. It connects with the personal and the social. and thinking and feeling about their lives are all closely intertwined. What this means is that personal histories and relationships and the societal and ecological contexts in which people are situated structure the kinds of choices that people can make, and in fact, the kinds of opportunities that people may be able to face, or the kinds of opportunities that they get. I'm just going to give you a minute to read this. So this is from our research in India. A married woman in Sarguja in India talked about herself. So this, she's talking about her life. And if you see the way she speaks, she is speaking about every important people in it. So she talks about, we thought one son should study at least and let the other one work with us and earn some money. If they had both gone to school, then what would we have eaten? That is why we couldn't afford for the younger one to study. And then note that he would go to drive somebody's bullock. Sometimes he would do casual labor. And that is why we did not educate him. And my heart pains for that my younger child didn't study. I feel sad. But what if I am sad we were poor? So how does this help us think in terms of people as relational subjects? As I said earlier, people are essentially connected to others. What they can do or be and how they think and feel is intimately related to how they are connected to others. So you could see that in that quote that I just showed you on the previous slide. What this means is that if you take a person-centered approach to well-being, and well-being in its essence is person-centered because you're looking at the world through the lens of people's lives, and you're looking, trying to understand people's own perspectives. What that helps you do is recognize how different aspects of life interconnect. But what it also makes you do is recognize how people are embedded, for example, in family or in peer relationships, and in the broader context in which they live. So rather than abstracting them as individuals or as social categories, we can see how this structures the opportunities that they face and the decisions that they make. Let's look at this in a slightly different way. Coming back again to the same quote, let us think about it in terms of dimensions of well-being. So if you think about well-being as constituted of three dimensions, the relational, the material, and the subjective, you can see that everything that this woman said can easily be understood in these terms. So if you talk about poverty, the poverty is about material life, having enough. So she says, because of our poverty, and then she says, talks about let one son study at least and let the other one work with us and help. The reason that I talk, if you notice, I have highlighted the work with us and help as relational, not just material. It is material, of course. But the reason that it is relational is also because working was something that was done not just for the self, but for other family members. So helping was helping the family. You were not working just for yourself and to earn for yourself. And similarly too, if you note that drive somebody's bullocks, or sometimes he would do casual labor, is also coded as relational, not just material. It is material as well, but it's relational because those are the kinds of, to even get that kind of work is through relational connectedness. So to give you an idea of how the dimensions of well-being are interconnected, you can see in that one quote, all of these three dimensions exist simultaneously. I turn now to talking about enabling environments. So from our research in Chiawa, Zambia, an Irish farmer said, "I've been thinking about what happiness is since reading your paper, and now I know what it is. It is freedom. Freedom that if you want to do something, you can go and do it. Freedom from the bank, freedom from employers, and freedom from the government. And I have got that." And a Zambian village elder, also in Chiawa, Zambia, says, "This is the land that I cleared. These are the mango trees I planted. This is the ground where I grow my vegetables. And this land could be taken away from me one day." So the quotes on the previous slide make us think a little bit about well-being drivers. So the well-being model has both dimensions, which are the material, relational, and subjective, but also well-being drivers, which are the environmental, the personal, and the societal. So if we think about how well-being drivers structure opportunities, and these are the underlying conditions and processes that enable people to, that either enable or hinder a sense of well-being. They can be thought of as the environmental, the personal, or the societal. So if you think about the environmental drivers, we know that both of those men who were in the quote on the previous slide depended on the vagaries of climate to make their living, and those vagaries involve both frequent droughts and flooding. And both of them had managed some way of irrigation to meet these challenges, these climate challenges that they would always face. But the Irish farmer had higher technology and farming methods at his disposal and a great deal more capital. At the personal level, both men were entrepreneurs and innovators, hardworking. Both thought about the community and what they were doing for the community. They were seen as being honest and fair. Both had various kinds of advantages in terms of societal drivers, primarily due to their gender and their age. But their differences by wealth and ethnicity were an important driver of difference between the two of them. So the fact that Zambian law and laws around land acquisition and the local politics enabled the Irish farmer to buy his land outright, while the Zambian elder had no title to his own land, which he had been farming for almost 30 years. And this was in a context, in a political economy where there was a great deal of land expropriation in this area. So these were the kinds of drivers, these were the kinds of circumstances that created an enabling or not enabling environment for these two men to generate a sense of well-being in their lives. So coming back to the drivers of well-being for a minute, we know that the drivers of well-being are three. They are societal, environmental, and personal. So on the societal drivers, we're talking about social identities, about economic and political organization, culture and norms and institutional structures, processes, the policy landscape, and the digital and communication environments. The personal drivers are about personality, personal history, personal endowments, and interactions with others in close relationships and within the community. And as we saw from that example earlier, they're affected by the societal drivers, but variance among individuals, but refer more to variance among individuals themselves. So a similar experience of discrimination for two different individuals can generate two very different kinds of individual responses for each of them. And finally, the environmental drivers, which we know are about the interdependence between living beings and Earth, and they affect well-being through various kinds of things: air quality, climate change, biodiversity, all issues that are current and all issues that we are grappling with also through this research program, through the YouGood research program. They could refer to urbanization, to climate change, most recently to COVID-19, and they're affected by societal drivers. They reflect how politics and policies shape human response to the natural environment. So they're interconnected with the societal drivers, and that is what might generate differences among groups of people, for instance, on issues of climate justice. So the reason we talk about relational well-being is that underpinning relational well-being is a relational ontology. So this is beyond both personal and social relationships. All approaches to well-being recognize the importance of relationships. So we know, for instance, that there are studies that say married people generally record a higher level of subjective well-being than non-married people. We know, for instance, in self-determination theory, that relatedness is one of the 3 essential psychological needs. And we know that the options that a person has depend greatly on relations with others and what the state and other institutions do, as noted by Dres and Sen. So all of these ideas of well-being talk about relationships. But all these ways of talking about relationships view relationships as exterior to the individual rather than constitutive of the self. So when we talk about relationships in relational well-being, we're not thinking of relationships as something that are external to us as individuals. We're thinking of how persons and selves are themselves are constituted in relation to others. So our very selfhood is relational. So we are always in relation to others, in relationships to others. What this also means is that relationships in and of themselves are neither positive nor negative. And generally, most approaches to relational well-being tend to think of, or certainly approaches that view relationships as exterior to ourselves, certainly think of having relationships as something that is positive. Whereas one of the things that we recognized through our research was that we are always in relation, and therefore relationships can be simultaneously positive and simultaneously negative. They can be supportive in some ways. They can also be hostile in some ways. So the same relationship can enhance your sense of well-being, but also hinder it. And that's an important thing to recognize, that these are there is always this tension in relationality of the positive and the negative, or even without such strong positive or negative charges. So relational well-being looks beyond individual psychology or behavior, and it looks to the underlying processes that promote healthy environments and happy lives. So this directs attention to the social, material, and spatially situated relationships through which individual and collective well-being are affected. As I said already, persons are relational subjects. We are fundamentally constituted in relationship to one another and through our societal and environmental contexts. And the character of these different elements emerges through our relations with each other rather than inhering within ourselves. One of the important things that you would have noticed when I was talking about, especially with the quotes from the men in Java, is also that change is powered by interaction. It's not just by individual actors or factors. So it is the interaction between the societal, environmental, and personal drivers that enables change to occur, rather than simply change being driven by individual actors. So all of that comes together in a relational well-being model in this kind of way. You would have seen this earlier. So what you see over here is that the well-being dimensions are at the center. These are the relational, subjective, and material. As I said earlier, they're essentially co-constitutive. Then you have the personal drivers, societal drivers, and environmental drivers, the interaction of which produces an environment. They're the underlying processes that enable or hinder a sense of well-being. And all of this is situated within a relational approach, which is thinking of people as relational subjects, employing relational thinking and relational working. You would have noted that I talk about dimensions of well-being, not domains of well-being. So domain-based, most models of well-being tend to be domain-based models, and they draw attention certainly to the multidimensional character of well-being. And one of the reasons that we do that is to simplify complexity. But the basis of deciding domains and what goes into which domain can be quite tricky. And the basis can be quite variable. So are they driven by theory? Are they driven by statistical compulsions? Are they driven by empirical research? Is not always clear. And from our research, we know that they're quite difficult to apply in practice. So what kind of question goes into which domain and whose understandings matter? So does our understanding as researchers matter more to what goes into which domain, or do people's answers to questions determine which goes into what domain? So if you ask people about how happy they might be in their family, people might answer with saying something like, we have enough money now, and therefore we do not fight. Now, where does that kind of an answer take you in a domain-based model? What it shows you is that the relational and the material are intrinsically connected, and of course also the subjective. But it does mean that a question on the family does not belong only in a domain on close relationships or on the family. It means that it is affected by another domain on economics or economic sufficiency. So all of these questions are they're constant. So this is they create kind of tensions in the methodological approach. And for us, they constantly raised questions about which question went into what domain and whether a domain-based model was the most appropriate way to understand well-being. Also, it's important to remember that a domain-based model is a construct. It's not how people think of their lives. And that is most evident, of course, in the way that people speak. And as you saw earlier on, one of our concerns when we undertook our research was to adhere as closely as possible to the way that people speak about their lives and how they think about their lives. We are concerned with how well-being is achieved, and domain-based models did not always provide us with a way of thinking of that. So again, the dimensions are essentially intertwined. They reflect our experience, and they adhere more closely to the ways people speak, with avoiding the need to discipline research subjects. So we're not forcing people to adhere to domains while they are talking about their lives. And dimensions draw attention again to interaction. They alert us to unexpected outcomes and spillover effects. And they talk about both process and state. I will stop now. And I think we can take questions, reflections, and thoughts.
I think we should first give you a round of applause. Talking to 120 people on Zoom is always difficult. So thank you very much, Shreya. We'll give you a physical round of applause, or we can use our emoticons. Colleagues, I would like us to take a few minutes to really ask Shreya questions, and you can write them in the chat. You can put your hand up. and then we'll ask Freya to respond to some of them. But I'll also ask some of the other team members who are in the room to respond. And yeah, so I think you can stop sharing, Shreya, then we can see hands and people. And maybe you want to just also write a kind of a quick comment in the chat about your response. Like, what are some of the things that are coming up for you in terms of understanding, in terms of thinking about how this relates to other theories that you think that you know about, other issues that you know about in terms of well-being. Yeah, so Vivian, you have your hand raised, so I'm going to let you speak, but let me also see if I can find another hand. We've got to go through a few screens in order to find hands. But Vivian, won't you put your mic on and ask your question? And then Vera, you've asked a question and I'll just read it out. And that is, do you have a definition of what you regard as relationships? So that's a question from Vera, and go ahead, Viviano.
Thank you very much, and very interesting presentation. I think my question is in regard to the theories that talk about systemic well-being, if there is any, and I mean, how systems shape what people think of their own well-being. And I come to this question because in the example you gave about the Indian lady, at the end she said, but what if I'm sad, I'm poor? So does that mean that it doesn't matter that she's sad because she's poor, that's disregarded by the system? Or, I mean, are there any theories or approaches that you have in regards to how really the system gives you the right to well-being or shapes your idea of well-being?
Okay, so coming back to the quote just for a minute. So she says, what if we were sad, we were poor? So the sadness is about that she could not educate her younger son and that he was forced to work. So that is about the sadness. But she says that there wasn't an option, the son had to work, so there was no question of educating him. So it's that tension between what one desired and what was possible. So just to clear that, this is always the danger of extracting quotes from a long interview without the entire context, which brings me to another one of my pet themes, which is that context is extremely important to understand the meaning of what people say about their lives and of well-being. Well, relational well-being is itself part of a family of systems approaches. Relational well-being, the fact that we talk about drivers of well-being, whether they're personal, societal, or environmental drivers, is very much about the systems that are constantly at work to produce environments that may support well-being. Now, in this presentation, I've only given you a very slight flavor of that. It's not a detailed kind of exposition of how that might work. There's more in the papers that I've referred to in my presentation, and you will, of course, get a list of that, and you can have a look at those. I'm not sure that I can offhand think of a systemic model of well-being in that sense. You know, something that's specifically only about systems. I would say that most models of well-being, at least those that we have come across, tend to be focused on the individual rather than on systems. So I can't think off the top of my head, but as I said, RWE is very much part of taking a systemic approach to well-being, the entire focus on drivers and the understanding that the drivers are part of the model. They are what drive how well-being may be achieved, I think is quite important. But if I think of something, I will come back to you, Viviana.
Sure, maybe we can ask Vera just to say a little bit more about why is it that she would like a definition with regards to relationships, so that you can pitch your answer at the area in which she's trying to ask. Go ahead, Vera.
Thank you. Thank you so much. And thank you for your interesting presentation. So I'm curious about your maybe conceptualization of relationships. I get the ontology, I get the relationality, and that's pretty much aligned with how I think about relational well-being in that sense. But I wonder in terms of positioning it on different logical levels. So if you talk about the relationship between people, how would you maybe conceptualize that kind of relationship?
I'm not sure that I've understood your question properly, but can I just, before, maybe rather than you clarifying and us going around like that, I'll just take a step back from your immediate question, if I may, and go back to my presentation from last month, if you had attended that. So if, the term relational well-being does a lot of different jobs actually in the model. And this is something that it's a valid kind of critique of, when people have come to us, they've said, what does relational well-being mean? But it does mean a number of, it represents various levels of relationality. So at the most immediate level, it means interpersonal relationships. It refers to interpersonal relationships. So it is a model of well-being that puts relationships at the center. Those are relationships that are interpersonal relationships. And as I mentioned earlier in my presentation, those make our lives meaningful. I think we can all relate to that. And they make it possible for us to get on and get by. As I showed in that quote from the married woman in Sarguja, getting work is also requires relationships. If you do not know somebody whom you can get work from, how are you going to get work? So interpersonal relationships at that level, which make life meaningful and help us get on and get by. That's the first level at which we're talking about relationships. Another level at which we're talking about relationships is the interrelation between dimensions. So we talk about the material, relational, and subjective dimensions being intrinsically connected, right? They're co-constitutive of well-being. So it's the interrelation between the three dimensions that produces a sense of well-being. So that's a second way in which we talk about relationships. Then we talk about relationships between, rather among the drivers. So it's the interaction between the societal, the environmental, and the personal drivers that produces an enabling environment for people to be able to realize some sense of well-being. So there's that interaction that is also referred to by the term relationship. Then, of course, there's the relationship between the drivers and the dimensions. So that's a fourth way in which we're talking about relationships. And another way in which we talk about relationships, and that's not sort of immediately evident within the model, but it's something that we've been constantly preoccupied with, is the relationship between concepts and methods, or rather between methods and the kinds of concepts of well-being you generate through particular types of methods. So, the way that what I've talked about, that, we started with a domain-based model, but eventually moved to describing well-being as constituted of dimensions, not domains. This was our methodological journey. When we began our research, we used a domain-based survey. We don't use that anymore. So it's, what is the methodological underpinning or the conceptual underpinning of methods, and in turn, what kinds of concepts of well-being does a particular method produce? So these are the multiple ways in which we talk about relationality. through the model of relational well-being. That's quite a lot to take in. We have a paper which talks about that, and I can always give you that reference and you can read about it in more detail. I don't know whether that answers your question.
Thank you. Thank you so much.
Or whether you'd like to follow up.
No, I don't want to take up more space, but thank you so much for your elaborated answer. Thanks.
There's another question in the chat from Matteo that asks about whenever environmental drivers are considered, it includes the physical aspects like infrastructure of the neighborhoods, the public spaces of a town, ? So I think it's, does it include all of these physical aspects? So
Yes,
Shreya,
absolutely. Yes, it does. It's very much, includes the built environment, the natural environment, all of those. Yes.
And then Judith Ojo Aromakodu has asked about, would you say relational well-being is always a reflection of emotions? Is it subjective to individual definition? That's a question for you. And then I'm going to ask Alex to ask his question.
Okay. So, sorry, let me just look at that question. Is it a reflection of emotions? So relational well-being takes individual emotion into account. So there is the idea of the subjective. So the subjective refers to how we are thinking and feeling. So it certainly takes that into account. But relational well-being is not primarily a psychological approach to well-being. The psychological is only one part of the model, and it is a model that is grounded much more in social context. Is it subjective to individual definition? I suppose I would say that the RWB model is a sort of mid-level model. It gives you a model and it gives you the elements of the model, the dimensions, the drivers, they are broadly defined. But for particular contexts, you could quite easily, you could contextualize it to different contexts. So in that sense, it certainly takes individual definitions into account. And I should also say that because it's developed from empirical research, it is derived very much from what individuals whom we have interviewed have said, and it takes those into account in the development of the model itself.
Okay, thank you, Shreya. Alex, can I ask you to ask your question?
Yes, thank you very much. And thank you once again for the presentation. Mine is also a follow-up from the last question. And I'm taking my cue from the ontology of relational being as being individualistic.
I'm sorry, are you asking whether it is?
And when you say that yes, I'm just coming to the question that if the assumption is that the relationships are exterior to the individual rather than being constitutive of the self, I'm wondering if we are not also considering the relationship between the individual and the self. Sometimes there is that internal interaction, which is also a form of relationship, which can also influence well-being. And that again it speaks to the idea of the subjectivity that was talked about. I wonder if in a natural fact we can completely exclude the relationship as being constitutive of the self.
No, I think so. The relational well-being model sees relationships as constitutive of the self, and that includes the relationship with the self, which is, I think, what you were referring to. And if you remember when I talked about the personal drivers refer to personal history, personal experiences, but they also refer to relationships within the self. So those are very much part of our thinking on relationship.
Okay, because what I'm reading here, you said in your slide, one of your slides, you said, but the underlying ontology remains individualistic, with relationships exterior to, rather than constitutive of the self. So that was why I was a bit, yes, so I agree with you. It is constitutive of the self, because sometimes the relation between the individual and the self is determinant on so many things, which can also predict well-being.
Yes, I agree with you. I agree with you on that.
Okay, thank you very much for that. Yeah.
Thank you so much, Alex, and thank you, Shreya, again for your presentation, and colleagues for your responses and your questions. And I can see that we are getting a little bit warmed up in our questions and in our interrogating of this notion of relational well-being, which is exciting because that's really the purpose of why we wanted to put this program of work together. We are going to have a lot more opportunity to talk some more, but what I want to do is I want us to move on to thinking a little bit about how we use this concept of relational well-being, the theory of relational well-being, to guide our research practice. And I'm going to ask 4 of my colleagues actually to speak a little bit about it. I didn't introduce you to Eileen Kasi-Gantner from Foundation Butner at the beginning of our webinar, but I do want to introduce you to Eileen. And Eileen, I want to ask you to say just 1 or 2 sentences about why Foundation Butner, how they came to be interested in this notion of relational well-being, because I think that might also just help people in the room to understand the reason for this program of research. So sorry to put you on the spot, Eileen, but I know that you are always ready. And I know that you said you've got the same question as Alex. And then I'm going to ask Angelique Wilskut, to speak a little bit about this notion of how we think with a relational well-being hat on around the theory of it. And then I'm going to ask Dorothy Ngila from the NRF to speak about how we work in a relational way. And she'll tell you what she means by work as well. And then I'm going to ask Candice Groenewold to speak about how we do research in a relational way, because all of these are quite practical ways. But there's also a very strong philosophical, conceptual element to relational well-being, as Shreya has kind of laid out for us. And the thing that excites me the most about what Shreya has said today and your responses is that you're already beginning the task of interrogating, pushing back, asking why, critiquing, seeing how it relates to other areas of theory. And that is really exciting for me in this study, in this program of research over the next few years. But Eileen, over to you. How did Foundation Butner come to this notion of relational well-being and your interest in it?
Thank you very much. So thank you all for being online. I think it's very exciting already, the questions. Fondation Butner went through a journey from being a very small foundation where we actually had in the original purpose the better nutrition, health, and education of children and young people. And then we said, okay, health and well-being to capture nutrition and education. But then we thought we don't have a good approach to well-being. We have no definition. So we looked for definition, and the proposal from Sarah White and Shreya resonated with our board, with our team, and we endorsed this approach, trying actually to understand what it means and to put this into practice in our program. But you've seen, Shreya, and it's very much thought. It's a program which is not so easy to grasp. It took a lot of time. And now we are trying to put this into implementation, but we felt we need more scientific underpinning of it in discussion with Sarah and Shreya. And we launched this program to really either underpin what works in practice, show where it is going to have to evolve for the use in practice, show how it connects, because you have OECD, other well-being program for me, I would like to see, but how does it inform Fondation Bodnar program? And we want to have critique of how is it useful, because and how can this evolve? So we have long discussion with Rhea and Sarah. We are open to evolving, to learning, so and bringing the multi-context view. And how to, does it stand? How does it connect to other things? And how is it useful in practice?
Thank you so much, Aline. Angelique, can I hand over to you?
Yes, thank you, Charlene, for that. You can. Let me just start by introducing myself for those that don't know me by now. I'm Dr. Angelique Volskut, and I am part of the program team. I will be taking you through a little bit of the structure of the program, and that will give you a better sense also about who's who in the zoo in terms of this whole project team. Okay, so let me switch over to my slides. You will tell me when it is.
We can see it.
Okay, great. Thank you, Charlene. Great. Thank you. Okay, so just to remind you where you are, we are at our capacity development webinars today, and this is part of a series of 3. Okay, I've indicated that we will be doing today. Charlene has indicated today is really about deepening our understanding of the principles of relational well-being. Tomorrow is more around theory testing, and then the last day is about approaches to foster meaningful collaboration. But first, a reminder of how this program is structured, so that you also have a sense of where this capacity development focus comes in, as well as where the projects fits into the funding of the projects fits into the overarching program. So I've decided to share with you a slide around what we envisioned just in terms of the program governance. So just to be clear, this is a partnership between the Human Sciences Research Council, the National Research Foundation of South Africa, and Fondation Bodnar. The NRF plays the program leadership role, whereas the HSRC plays the academic leadership role. And we have already been made aware that Fondation Bodnar is our funder in this program. It is constituted by a program leader in our NRF side, and a team that also draws on the linkages and networks that they have with partner science granting councils in the relevant countries. One of the important structures in our program is the advisory group that we have. And the reason why I wanted to just talk a little bit about the constitution of our advisory group is because some of our frequently asked questions really asked us, what kind of support will be offered to different projects? And is there scope for either the writing of consultants into projects or the writing of advisors as part of our project team? And so we want to say quite clearly that our advisory group is structured by a youth steering committee, which has representation across the 12 countries of the call. And then we also have, as you have seen today, we've got an expert on relational well-being that is part of our advisory group. We also have an expert on research evaluation that is part of our program. And then we also have 4 thematic leads that will also, thematic area experts that will form part of our advisory group. So this would be experts that have a background of either livelihoods, mental health, climate change, or digitalization, alongside some experience also with work on well-being. And so all of these experts are available for advice in terms of the program, and they also give us input on the expression of interest as well as the proposals that will be submitted. And so this is a project structure that exists exactly for that purpose of being able to provide expert advice through our community of practice and to support different projects throughout the program. Of course, I've indicated that the HSRC plays the academic leadership role, and the way in which we've spread that across the team is that we have a thematic lead on livelihoods, one on mental health, one on climate change, and one on digitalization. And that is why you might have seen me refer to myself as the thematic lead of livelihoods at different points in time as well. We are also supported in this team by a research manager, a monitoring and evaluation specialist, a youth engagement specialist that will also be appointed, as well as a science engagement and communications partner. But we thought it was very important to highlight the structure of the program so that project teams are also aware of the kind of support that is available through the program. Then this slide is very busy, but I thought within the context of sharing the slides with the applicants after this session, they will then have access to some of this detail, which I think is useful for them as well. So the reason I wanted to just remind us of the program objectives, I wanted to show that the way in which we have structured the implementation of this program is alongside 5 different work packages. So we've categorized it into 5 different work packages, which then helps us to implement this program. Obviously, the funding of projects, that's quite clear. And then secondly, the capacity strengthening aspect, which we think is very critical. And this webinar of today forms part of this capacity strengthening aspect of the program. I've also mentioned the community of practice, which is an important element as well, where we seek to expand the visibility and reach and applicability and the impact of the program, and to share as we learn on this journey around the application of relational well-being. And a very important aspect as well is the monitoring, evaluation, and strategic learning component, which is where we seek to foster accountability and learning at the programmatic and research project levels. And then finally, of course, the communication and dissemination work package, which is around making sure that we innovatively capture, synthesize, distill, and translate the knowledge. But the reason I just wanted to present this overarching picture was just to locate the capacity strengthening as one of the important elements of focus. So what do we seek to do in the capacity development? The capacity strengthening of young people and researchers. Well, how are we seeking to strengthen young people and build their capacity through this program? I've alerted you to the fact that we have included young people from the 12 focus countries into our youth steering committee and into our community of practice as active participants and co-producers of knowledge in the research projects. And we think this is important to capacitate them around the governance of research, but also the conducting of research. What is the focus? The focus is training and mentoring and providing experiential opportunities that relate to governance, decision-making, project design, participatory action research processes, but also the analysis and interpretation and monitoring and evaluation that we seek to do differently in this program. The outcomes that we seek to achieve is active and meaningful and appropriate and empowering youth collaboration throughout the program that contributes towards co-leadership, co-creation, and the co-ownership of knowledge. The focus of the capacity strengthening, of course, is not just on the young people, it's also on emerging and established researchers, and this is the kind of webinar that we are doing to meet that objective. So who is included or who is referred to when we talk about emerging and established researchers? Here we are talking about the grant applicant and recipient researchers and early career researchers that are attached to the different research projects. Who do we focus on? This focuses on the period of the expression of interest, as we are doing now, and as well as the support of the actual full proposal process, so the successful recipients in towards when we actually have the award of the full proposals. So here we want to help and assist on conducting research relationally, theories of change, theory testing, decolonizing knowledge production. There's quite a long list of titles and topics that we would like to cover through this capacity strengthening of young people and researchers dimension of this program. The outcomes is that we hope that this will contribute to well-informed and high-quality expressions of interest and proposals, and the production of innovative, relevant, contextualized, credible research findings and analysis, and for us all to then strengthen the conceptual, theoretical, and methodological tools and our capacities relating to young people and their well-being. And I think here also I just wanted to make the point that, and we discussed this in a pre-meeting this morning with Shreya and colleagues, that yes, we know that there are a lot of technical questions, and of course these must be dealt with, but the importance of the content and the quality of the proposals, that is of course the most important aspect, because if the quality of the content is not at the level that is required, then it doesn't matter. All of the technical aspects of eligibility really doesn't matter. So we put a high premium on this aspect. I've included just some of the details of the titles of or the topics that we seek to engage with over the 3-year program, but of course, this will be changed as we move along. But the idea behind it was just to give people a sense of what kinds of topics will be covered over the 3 years in terms of capacity strengthening, because we also saw in the frequently asked questions some requirement for strengthening around particular aspects. And I think if you scroll through some of the topics that we seek to cover, you will see that they might already be covered in our plan. Of course, our plan also provides for the identification of other topics that our successful projects might identify as well. And so we will be engaging and co-creating and building more on this plan for over the next 3 years to make it meaningful and responsive to the needs of the project teams. Okay, so I took a step back now and reminded us around the structure of the program and what we envisage on the capacity strengthening. And I also spoke to you about the titles and the topics that we seek to cover through the capacity strengthening. And but now I want to focus us on the second part of the presentation, which is really to talk us through what does using relational well-being as an approach mean within the application of research projects. And we engaged quite closely with the work of White and Jar, but we felt that there needed to be just one extra element that we wanted to highlight as YouGood is engaging directly with the relational well-being model that Shreya has just shared and described and for us. And so, of course, if we are to engage with relational well-being as an approach, it of course requires us to employ relational thinking. And this aligns with the model of Shreya and Sarah, because it is very important that relational well-being is approached and engaged with as an ontology. So this means relational theories, concepts, and frameworks must be applied. So if we are engaging with relational well-being, this is an important ontological position that we must bring to that engagement. Of course, it is also important that we employ relational working, and this means embracing relational ways of working. And I've noted the construct there is epistemology. So ontology and epistemology, of course, are linked. And all that means, of course, and I know I'm talking to astute researchers in the room, but just for the benefit of those that are not as familiar with these terms, of course, ontology refers to the way of being, so how we understand the world to exist, and epistemology refers to our ways of knowing, the ways in which we seek to understand the construct that we are interested in employing. And that, of course, then relates to the methodologies that we employ. So this is where the aspect of relational gathering comes in. So here we are talking about employing relational designs in our research projects. So each of our team members will speak to these different elements, but I thought it was important just to make it very clear that, of course, White and Jar's model of relational well-being exists. Shreya has given us a very good description around all of the different aspects and the complexity around the conceptualization. But when we thought around presenting a very simplified way in which to apply this in practice, we thought it was important to highlight this aspect also of relational gathering. Okay, so I will just speak briefly then just again about relational thinking, and then I will hand over to Dorothy to talk about how we are engaging with the notion of relational working within this program. So this reiterates a lot of what Shreya has already indicated. So how do we engage with the notion of well-being? We see it as inherently relational. This is our ontological position. It is viewed as more than subjective happiness, materialism, or the quality of relationships. And equally, we view individuals as relational beings existing within a multidimensional ecology. We view relational well-being as a unified theory to understand and research well-being. And this is what makes this model slightly different to the way in which relational well-being has been dealt with in the literature over the last few years, and most distinctly. We see well-being as relational in a collective and a multidimensional way as it emerges through the interrelations of personal, societal, and environmental structures and processes as indicated by White. We see that well-being is shaped and reshaped by our subjective and collective interactions with a multifaceted world, which includes, of course, individuals, families, communities, structures, spaces, beliefs, our norms, our cultures, traditions, and laws, etc., within the political context. And so this is how You Good approaches the notion of relational thinking in its applied manifestation. And then on relational working, I will hand over to Dorothy to take us through a little bit more how we have practically employed this principle within You Good. But the notion underpinning relational working is that even in the way in which we conduct the research and we engage with different project teams and in the way in which we engage with the subjects of our research, is that we must facilitate co-production of knowledge, and those interactions must be empowering, and it must promote capacity building and co-ownership of the research or interventions. And so we have had to go through a little bit of trial and error in the way in which we implement this notion of relational working, and we see it in our program. And I would like to ask Dorothy Ngila from the NRF to just assist me on reflecting on that.
Thank you very much, Angelique. Good afternoon, colleagues. My name is Dorothy Ngila. I am at the National Research Foundation, and I am the partnerships lead with regard to the You Good program, as well as the program leader from an NRF perspective. In a very practical way, what relational working has meant up to now, which we would consider as the inception period of this program, is that we needed to focus on building a consortium amongst the program leads, building a relationship with the grant holders, not just thinking about grant holders as statistics in the NRF context that are getting grants, ensuring that the program was anchored in how relationships are built, most importantly, how they are nurtured across the program, but also in the different projects, and very much focused on lifting up some principles through experimentation and recognizing that what we have to do is to be very much focused on what are the values that underpin the way that this program is being implemented, in addition to productivity, performance, and delivery of a program itself. And practically, it has meant, marrying a lot of the principles that we talk about when we talk about equitable partnerships, right? It has meant building trust. It has meant really making sure that we have enough time to get to know each other, to gel as a team, to be able to make extensions of deadlines so that you are able to submit proposals that would actually be winnable, but also to be able to build your own consortia that you are focused on. It has meant that we needed to infuse a lot more flexibility in our granting and contracting process, both with Foundation Botna, but also the way that we wish to contract with you when you are successful to be funded. It has meant that we needed to include a lot of time to consult before we could even start putting together the call. We had various consultation workshops, we had various consultations with different levels of people, other funders, other researchers, young people, people who would be utilizing some of the findings and insights that we have. Most importantly, also thinking about how we co-design the program, the NRF as a funder, the HSRC as the academic lead, Foundation Botna having such vast experience in supporting young people in the Global South and being able to move beyond you are the funder, you're the funding agency, you are the science council, and really coming together as individuals, and it takes a lot of time. And in closing, I would say, thinking about You Good research program is a really good experiment for us to be able to bring out lessons on what it means to build equitable partnerships, what it means to think about relational working as a way of implementing a program like this one, and experimenting in the way that we meaningfully collaborate with each other from a program perspective, but also collaborate with you. And the next slide is not meant to be talked through, but it was kind of a step-by-step thinking process from all of us, what it took between 2022 and where we are at the point where we were launching the program, just for you to have an idea of the time it needed, the trust building perspective, and the intentionality to make sure that we were thinking about a program framework that had more viability within the context of the Global South. Thank you.
Dorothy, before you go, let me ask you one question, the way that I asked Eileen. One of the other hats that you wear in the NRF has been around the notion of engaged research. How do these two link, a relational approach to working and engaged research?
Oh, I would say very much so. On the one hand, we are learning very much from the engaged research work that the NRF is currently funding and currently also conceptualizing. And on the other hand, we are looking at how that notion can be implementable in a research program that involves us partnering with a science council such as the HSRC in a very different way than how the NRF would normally partner, but also together then partnering with all the grant holders. And for me, it's also bringing out from this program, what can we say about engaged research in the context of the Global South, in the context of young people who are the biggest population, and wanting to draw from this program some of those lessons to strengthen the way that we will be putting out our frameworks and thinking through engaged research from a funder, but also what we expect from the funded projects we have at the NRF. Thank you.
So we're hoping that things will shift generally in how we do research, right, in going forward. So that's a really important piece of this project. Thank you, Dorothy. And Candice, you've got just one slide to talk about relational gathering, because we've got a whole day that we are going to give to you on Thursday. But please, won't you take us through relational gathering?
Sure. I think this is also a more relatable component, if I think also just reflect about the kind of applications that we received. It seemed like people understood this relational gathering perspective, but more from a participatory action research perspective. And so I think Shreya, you earlier Shreya made a comment around the methodologies, and I kind of zoned out a little bit just because of my network, but she said the methodologies that we use, or the methodological underpinnings of our approaches, really inform or dictate a little bit the kind of information we're able to generate or develop or engage with, right? And so we come from that perspective that relational gathering must understand that relationality must be present in everything that we do, including how we engage with our participants. And Dorothy spoke earlier about how we work with our stakeholders, so everybody within our group. But this relational gathering is really about how do we gather information from our participants in a way that facilitates co-creation, co-investment and collaboration. And it does naturally gravitate toward more participatory and emancipatory outcomes or approaches. But I wanted to just quickly give an example of how in more structured designs, so we do have applicants that are doing RCTs or testing through a very particular kind of methodology. And it can be a little bit uncomfortable to think about, there's a very specific methodology that I'm supposed to use, and we don't want to lose the significance of the methodology, but we do expect the research to cover and to think about how do I gather information in a relational way. So an example that I can give you that I've done a couple of years back, we conducted the first point-in-time census on homelessness in Durban, South Africa. It was a mixed methodology, very specific methodology for the quantitative component, the census component, and obviously a qualitative, more participatory kind of approach. We didn't at the time call it relational gathering because we weren't doing this work, but we had to think about how do we work collaboratively? How do we co-create the information, the different tools that we have, the outputs that we want to generate, the interpretations that we get from the information with different stakeholders that are invested in the lives of homeless individuals or people experiencing homelessness. So what that meant for us was, for the quantitative phase especially, was to think about what we now call our community of practice, our advisory networks that entail different stakeholders that were invested in the lives of people experiencing homelessness, including people who are experiencing homelessness at the time, previous experience, and civil society, government officials, all these different stakeholders. What that meant for us and how that relates to relational gathering was we had a very structured approach to how the census has to happen because there's a methodology attached to it. But relational gathering for us meant going to our groups and asking them about the tools that we are using. Are the questions that we're asking applied? Are there anything else that we need to be considering that will help us to understand the context that we are interested in? Are the type of language that we are using appropriate for what we are asking? And so forth. So what I'm trying to say is, there does seem to, from what we received in terms of the application, that there's a general understanding around that there has to be relational gathering. But I think to think really meaningfully about how do we embrace a more collective and consultative kind of perspective around how you generate your work from the inception to the end of the program. And so we want to challenge you in thinking about relational gathering in that way. It is not just about saying, I'm doing participatory action research, but if we're doing other types of designs, whether these are exploratory, descriptive, intervention research, developing policies, how do we bring in different voices in a meaningful way that does foster co-creation and collaboration at the end of the day? So Charlene, I think I'm going to pause there.
Great. Thank you, Candice.
Yeah.
I do think, colleagues, that I'm sure I can read your minds. There are probably, 100 questions that you have. And you also, what I think you're doing, you're also saying, how does that affect me and my proposal? I also think that you might be saying, this sounds like a lot of work. And I am in a stage or phase of my career where I actually don't have time for this kind of work. And so, and I'm not saying that in a negative way at all. I'm just saying that one of the ideas behind this capacity development is, one, we help you to know what you're getting into. Two, we're trying to give you some tools for making sure that you can write a proposal that meets the needs of us as a consortium, the NRF, Foundation Botnar, and HSRC. But also, we want you to say, actually, this is not for me at this stage. And also for you to know that we've got 80 proposals, expressions of interest that we think can go forward to this next round. But maybe you want to say, no, thank you. I think that the theory of relational well-being, as you've expressed it, is just too much of a swing of the kind of work that I was thinking and proposing about. On the other hand, we're hoping that a lot of you are going to go, wow, this is really exciting, because we're in the ground floor of a theory that's been around not for a long time in terms of the development of theory, and we really have got an opportunity to critique it, expand it, extend it, propose an alternative, deepen it, make sure that it is able to be implemented. So these are all the things that I hope that you are reacting to as you've listened to both Shreya speak about the theory of relational well-being, but also as you've listened to Angelique and Dorothy and Candace speak about how we got to this point, and also these three dynamics which you will need to put into your proposal. We've got on the program a few questions, a few minutes for questions of clarity. And yes, Thomas, we will definitely share the slides. And if you look at the website for the YouGood project, you'll see links to Sarah White and Shreya's work very soon. And we're also going to make sure that you've got all of this information going forward. We have put on the program, there's some time for questions, but I want us to break up into conversation groups, and Yoliswa has put us into some conversation groups where the question is very simple. What is your response to what you've heard Shreya speak about today in terms of relational well-being, the theory of relational well-being, but also what is your response to what my colleagues has just spoken about in terms of relational thinking, relational working, relational gathering. And then we'll come back together after a while and we'll take questions, comments, learnings, because we think that you will have insights for us. That you'll tell us, oh, this is too difficult, or what do you mean by that, or how do you seek some clarity. So if there's something that comes out of your conversations, either about your own project, about how you go on with the next step, or something that we can do better. I watch a home improvement program at the end of every time that he's shown someone a house. He says, so what can I show you differently tomorrow? And that'll also help us tomorrow as we go on to talk about theory testing. How can we make this interaction within the limitations of Zoom and being online? How can we make it more helpful for you? So Yoliswa, I think I'm going to ask you to break us up into groups. We've got 30 minutes in our groups. Go and grab a cup of tea or glass of water, join your groups, and we will pop into some of these groups just to see how things are going. And after 30 minutes, we'll close back and we'll have a facilitated discussion and we'll raise some of the questions that have come up in our groups. Thank you, everybody. Let's do that. Let's break away into our groups. So, Yoliswa, select a group, but I think you need to get us into our groups first, Yoliswa. So I think there's just a random way of doing that, or have you assigned people to groups?
No, we're going to do it randomly, Shalene.
You mean people must join a group, any group?
Yes, they will be they will be sent to the group right now.
Okay, off you go, then do that. So I think you haven't set it up to do that, right? Because people aren't moving out into their groups.
Is Moses on the group?
Open all rooms. Should we do that? Okay.
Oh, sorry, I'm on mute. We are opening all rooms now. Yes.
Okay. But I think what you haven't done is you haven't said assign people randomly. It's asking people to join the rooms. That's the problem.
Okay. I'm working on that, Charlene.
Okay. Colleagues, maybe while Yolisa works on that, we can take a
I
couple
thought
of-
people were taking a leg stretch and come and find themselves in the rooms, Charlene.
Okay. Well, sure. I think we're losing a few people. So yeah, I'm just thinking here. Okay. Yeah, colleagues, can we just take a minute? We just need 2 minutes to sort the rooms out. A little bit of technical issues. Thanks, Viviana, for giving us a bit of hope, because we're looking a bit flustered here. Candice, can you play some background music for us while we
I can sing. Do you want me to
No,
sing?
no, I don't think we want you to sing. I'm not sure about that.
Yeah, I'm also trying to just see how to do this, but I do think it is something that needs to be facilitated from Moses' side.
It's fine. I can open those rooms and
And
assign
let
them.
people be and let people just automatically be assigned.
Oh, okay. So they're not going to choose the topics. Okay.
No, there are no topics. The topic
Okay,
is
sure.
one. Yeah.
All right, sure. Thanks.
So you'll do that for us, Moses. Thank you.
Yes, I'll do that, Charlene.
But you'll allow us, Moses, to roam, hey? The
Yes,
presenters.
the
You will
presenters
allow
do
us
have
to roam.
the,
Great,
the
thank
presen-
you.
Yeah, the presenters do have their rights. All breakout rooms will be closed in 45 seconds. Let them just close and then I'll quickly do it. And then it's for 30 minutes, eh?
Yeah.
Sure.
Please.
Okay.
And perhaps we should just reshare the questions that were shared earlier. I think Yolisa shared them. There was a message that popped up with them, so I don't know if they will be open in the.
Yeah, we can broadcast that back to the rooms. And it really is for you to think about how you're applying it, and any questions that you have based on the presentation that Shreya did and we've done. So, okay.
Participant to choose one participant to attend. Okay. Okay, I think we are ready now.
Okay, go for it.
Just open the rooms now.
It's the same. Now everybody's jumping off. Is that right? Okay, I mean, I'm just going to assign people to rooms. Moses, don't worry. Let me just do that. Candice, can you also do that? Just assign people to different rooms.
So I actually cannot even see that there are rooms created.
Okay, don't worry. I'll do it.
Moses, could you also give me roaming rights? I don't know if I have that.
Yeah,
yes, you do have it, Candice.
Okay, thank you.
Okay.
Right, colleagues, welcome back. I hope you had a good conversation. And sorry for the rocky start. And we've had a couple of people who've just asked to send the link for the website again. So we'll do that. Also the recording, of course, we'll do that as well. But colleagues, if I could ask, we're not going to go through all 15 rooms and ask for formal feedback from every group. And so again, there are two opportunities. One, if you want to maybe put a couple of concerns or issues of clarity in the chat. But if you maybe want to report back on some of the questions that have come up in the group, and let's start by asking some of the questions about kind of the theory of relational well-being on one hand, and then in a few minutes we'll talk about some of the, how do you see this working in practice? What are some of the issues of clarity that you may need that the team can help us with as we go forward? So I did ask for you to just make sure that there was somebody who would speak for your group. But yeah, if we went through every group, it would just take a little bit too long. But yeah, Thuli Godfrey.
Good afternoon. I was in room 8. So in room 8, there was also some few questions that the colleagues also needed some clarity on how does RW applies to their studies as well. I will just recall one of our colleagues she was asking about developing a tool then, but when you look at the RW, if you want to develop a tool, it should also be informed by the information that you will gather from the young people, because after all, you will check if the tool applies to what is in their contextual area. So I've also highlighted that in order for them to develop the tool, they can start from a qualitative manner in a way that it will guide them in the process of developing the tool so that it will be contextual and also relating to the setting of where they want to test the tool, because they can't develop the tool on their own as researchers and then now want to test the tool. So the important thing is to start with the involvement of the young people where they will share their knowledge, and that is where the co-production of knowledge will come in. Then their tool will be informed by the information that they've gathered, and it will be relevant, and that on its own, it will also get a buy-in from the young people because they were involved in developing of the tool, but based on the information that they also shared before it's being developed.
Absolutely.
Yeah.
Absolutely.
So that is what is coming from group 8, but most of the questions what our colleagues were asked were clarified and being explained how does the RW applies to their studies.
Okay. And did you answer those questions yourself, or did you have somebody in the room who was busy giving you some answers?
I'm the one who was also sharing the answers because of the understanding of the RW. Because if you speak about the relational working and also the relational gathering, that is where you need to make sure that you understand the approach, because if you understand it, it will start from the beginning of the project up until the end. It means you don't leave those young people behind. You need to carry them with you. You're holding each other's hand, because it's more like a collaborative and it's more on a collective well-being. Then from there, it will help you to be able to do something that is contextual, especially if you speak about the Global South. We always known that we do research and then we leave people, and then now it's an opportunity to recognize them and show them that we consider their experiences in order for us to develop interventions that are more contextual and relevant to their issues that are affecting them, so that they can come up with the solutions. And their agents is very key when it comes to relational well-being, because they can make decisions and come up with solutions that are bringing change into their lives. That is why it's more empowering, because they will be able to engage in the concept, whatever that is being done at that moment. Thank you.
Fantastic. Thank you very much, Thuli. Another group, maybe some concerns or some issues or some questions. Go ahead, Kay, Nyagen.
Hi, thank you. Actually, I'm the same group with Thuli, and I was the one who raised the question. So just want to give a little bit of like background to why the question was raised. So basically, our research team were thinking of, our research question is more on finding out what kind of digital interventions that would be suitable for the young people context in Vietnam to improve their relational well-being. So essentially the output would be determine which kind of intervention digitally would have a positive impact on the relational well-being of young people in the Vietnamese context. But then emerging from the discussion we have with our group, I think another consideration is also that we should also be incorporating the framework and the principles of relational well-being in the way we design the research method and the tools and the framework to test and to measure the relational well-being of young people themselves. So I think that was when we kind of had that discussion that Julie was introducing.
Sure. And one of the things, colleagues, that as we looked at the expressions of interest, some proposals were tools that were already in existence and people wanted to test them. And so one of the things that you would have got comments back on is sometimes some of the pre-existing work, you need to almost start afresh or tweak it, because we do want to make sure that all aspects of relational well-being is incorporated, both working, designing, being participatory, as well as the theoretical aspects. So I think that's a really good point for the whole group. Another group, maybe you'd like to add on. Candice, don't you want to just speak about it rather than you've just written a long thing that I can't
Sure.
read?
No, sure. I wanted to give other people a chance to talk, and if but yeah, so we had a great about 3 researchers. We had 4 and 1 dropped off in the session, but 3 researchers. All 3 seemed to be comfortable with what was presented today, and felt excited about the sessions that are coming up, and how that would help them with their applications. There was 2 researchers kind of brought up the issue of theory testing, and we were just talking exactly what you said now, Charlene, that it's when whether it's theory testing, theory development, or measurement development, all of those kind of things, it still requires evidence around developing that theory or critiquing that theory or proposing something new. So if it is about theory development, or saying, there's a theory that I have and I think this one is better than that one, it's not just about comparing them theoretically. We must think about, how are you doing this in a relational working way? How are you doing a relational gathering in developing or critiquing or proposing? So it was exactly what you said earlier, that it must be comprehensive through these kind of the 3 pillars that we have as part of the relational wellbeing framework. So
let me push back on that one issue, Candice, because I think that might be helpful. Let's say somebody isn't envisaging any empirical data collection, that they're actually proposing some conceptual and philosophical debate around an aspect of relational well-being. How do you work relationally in that context? How do you gather relationally? And so one example might be that it's not just you sitting in your room writing very furiously in your study, but actually you might propose a range of seminars in which to get input around the work that you're doing. So you've got to actually think quite creatively about what it means to work philosophically and conceptually on a project. In a sense, working empirically is almost easy to do in a relational participatory way.
Yes, Charlene, and just to add to that also, to not neglect the voices of young people and the involvement. So not just the voices, but the involvement of young people in the development.
So that's going to be
so that's not just academic people talking about this theory and it's a seminar for them, but it's that how do you bring young people in? How do you do the capacity development that we ask you to reflect on in the applications and so forth? So yeah, thanks, Charlene.
Megan, you asking, will we receive feedback on our concept notes? And so Dorothy, Patrick, maybe you want to just make a comment on that at some point. Yeah, maybe not now, but go ahead, Dorothy. Yeah, go ahead.
Let me just check with Patrick and I will definitely.
Okay, great. I saw another hand that came and then left. Okay.
It was mine.
Ah, Simon, go ahead.
It's Simeon, yeah.
Simeon.
I think maybe I should reflect one of the concerns that was raised in my group by one of the participants. It's about the instrument, the tool, the application form. I think some colleagues were saying that there are some components of that form that they are finding a lot of problems with. And it's like they don't know what to do with, like how to draw out an ecological mitigation impact plan. And they were saying that, you see, this now is like putting them off. So I was saying to them that maybe in the course of tomorrow and the other day, they might cover these aspects which are in the application form.
Well, firstly, let me say, Simeon, that you are not alone, that when we've gotten any questions, it's been around the ecological mitigation plan. And colleagues, we are wanting it to be part of your study, is to think about the impact on the planet in terms of what you're proposing. And it could be anything about the travel that you're proposing or that you're not proposing. And it's not to say that we're saying we don't want you to travel. Sometimes it's really important to travel, but is there ways of minimizing our carbon footprint when we travel? And it could even be in terms of when you're working with young people, and I'm going to give a small trite example. When you offer refreshments, are you using plastic or using recyclable materials? It could just be something like that. And remember, this is just one small piece of mitigation that we're asking you to think about. We're also asking you to think about diversity and equity and the role of young women involved in the study. So we're asking you to think about a number of different aspects, but you don't major on any one of them. It's not like we want a whole proposal on mitigation. We want you to have a plan for mitigation in terms of the planet. But do we have any other opportunities to talk about the actual proposal, Angelique? And then Zander, I'll ask your, I'll take your input, but yours first, Angelique.
Yeah, Charlene, we were talking about it this morning that potentially in our last day where we are focusing on meaningful collaboration with young people, we're also going to touch on some of the other aspects such as diversity, inclusion and equity, which is also one of the aspects we require projects to reflect on. And we want to, because we think that the Youth Steering Committee inputs might be slightly shorter, we want to spend a little bit more time potentially at the end to just pull together what other outstanding aspects there might be that we've already seen coming from the frequently asked questions. So it's definitely around the ecological mitigation plan. It's like people want a little template. It's definitely around meaningful collaboration with young people, because we also ask for a plan on that. There's also very specific sort of questions around the partnership building. And so we are trying to infuse that through these 3 days, but also create a little bit of a space at the end of day 3 to talk about those outstanding issues that we see is emerging from the frequently asked questions. Thank you.
Thanks, Angelique. Zander, won't you go ahead with your group's queries or questions or insights?
Thank you, Charlene. Good afternoon, everyone. We were in team 1 or group 1. We were about 6 participants. One of the concerns that were raised focused on originality of the proposal versus alignment to the funding call, and a concern around if all of us attend these workshops, will it not result in a standardized narrative and perhaps reduce the originality of the proposal and the research project that is proposed, but not only the originality,
You put yourself on mute, Zander.
Sorry. The originality and the uniqueness of the proposal. So where do we find the balance between the alignment and adherence to the funding call and what is expected, but also bring in our own voice? And then the second concern that was raised, or more question, is what you touched on earlier, Charlene, is not only collaborating with youth, from the onset, but how does one make that really meaningful? Thank
Okay.
you.
I can see you were probably gesticulating with your hands as you were talking, which is why you put yourself on mute. But Xander, I think those two questions, the one tomorrow, we're going to, on Thursday, sorry, we'll speak about the meaningful participation. But I also want to just comment about this originality idea. I think that we're a group of, and we know, who's in the room, that we're actually quite a group of experienced academics. Yes, there's about 20% to 30% of kind of emerging younger academics. But we are quite, we're quite experienced. And I think that we know enough to be able to push back against the theory. We're able to critique it. We're able to expand it. We're able to offer alternate versions. And I think that we aren't going to be spending so much time speaking about one perspective on relational well-being. We've done a review that we've got on the website. We've invited Shreya. Shreya will be with us. We'll be looking at these proposals together. But in the end, it must be our voices. It must be advancing the knowledge project that is from the Global South. And I think that's really important. And I think that everybody who evaluates your proposals will know that. It won't be, oh, they don't like this piece of the theory and therefore we're not going to fund their project. Not at all. We really want to be open to thinking really deeply and generatively. And we want to make that commitment to you, that we're not trying to get support for one particular aspect or one particular view. And if you've got counterfactuals or, new creative ways of thinking, we will see and hear that. I think we can assure you of that. Chelsea, why don't you go ahead, and then Eileen, or Eileen, is it on this point? Because maybe you can just add to this point.
Well, I would say through the variety of the context that you represent, there will be also a big bandwidth of what you can do, what you want to do. And then I just wanted to activate the thinking that think across social science to also other discipline. We were very keen on involve mathematician or physicists or whoever. So you have also an art, we thought. So you can also use so many channels. And so I think there is a lot of freedom. And I think I see these seminars more to help understand what is behind this relational well-being from the conceptual approach. Because from my experience, it took us more than a year. And here you need to prepare a proposal in short amount of time, even though we have, left time. Yeah. So I think it's more about not restricting the researcher to think the same, but it's helping to quickly deep dive. Over.
Yeah. Thank you. Shreya, did you want to comment?
Yes, just a very quick comment. Aline has said part of what I was going to say, and so did you. So partly it's about context that makes proposals different and original, but also I think it bears repeating to say that one way of applying a model is applying the RWB model is to think from the perspective of your research participants and what does relational well-being mean from their perspective, and that itself is going to bring a lot of, I think, slightly different views in each of the proposals. So depending on what it is that you're planning to research, the context in which you're planning to research, it will probably look different from each of those. So as I said earlier, RWB is it's a mid-level model. It's a model that can be applied in different contexts. It can be contextualized, and how it's contextualized is one of the ways in which it might look different. And as Charlene said, one of the other ways is, perhaps if you choose to critique it, that is also something that will bring originality and difference. So, yeah.
Great. Thank you, Shreya. Chelsea, can I ask you for your comment from your group? Go ahead.
Thank you, Charlene. Hi. In our group, we talked about how our kind of multi-stakeholder and multi-country research teams have already started proposal writing by putting relational principles into practice. So sort of at this conceptualization and writing phase. An example there was in developing a participatory theory of change. We have observed and experienced that integrating these relational working approaches comes at a potentially great cost, not a negative one, but right, more preparatory time, for example, to consider models of participation across different partner types, right? Trying these out, having cross and transdisciplinary communication and understanding, meaningfully engaging and acknowledging young people as leaders and looking for ways to gather in person where it's possible. So I guess our question was, we were curious if the UGood Secretariat considered small planning grants for accepted EOIs. We've experienced this as a model other funders have elected to choose, especially in establishing equitable and reciprocal research partnerships. Thanks, Charlene.
I want to say that that's a fantastic idea, but it's a little bit too late, right? Because we know that the deadline is early in October. And so I think we will put that down to part of our learning. But also it's been something that we've been learning as the kind of secretariat is how much time it takes to really work relationally and make sure that voices are on the table and that there's real engagement. And that when things go wrong, that we have a way of relationally trying to, sort things out and make things go more smoothly. But the time issue, I think, is something that we need to think about quite a lot. And yeah, planning grants, if only we thought about it initially, because we hadn't. And I think now it's too late to steer the bus. And I think that's also a learning, right? How do you work relationally and you're trying to kind of build the plane as you're flying. But thanks for that, Chelsea. It's a good observation. Judith, go ahead.
Thank you so much for the opportunity. In our room, there were 4 of us, and we all introduced sort of a brief idea of what our topic was about, and very, very different and diverse kind of research interests. But one thing I think we all agreed on was that we needed to keep it focused on the relationality between in the research, even in terms of the methodology, the ontology, and how we approach it, even in doing the design. The other thing that came out was the issue of trust, and even just developing that as a point of building relationships in the process of doing the research. And that became, it came out that would take some time, and how then do we incorporate this in the whole process of the research, even in terms of the relationship between the researchers, and then how do we co-opt our participants as co-producers of knowledge, and because it's about well-being, the level of vulnerability that may need to be shared and the confidentiality that may come into it was also something that we discussed.
So thank you, Judith. I'm not sure if any of my other colleagues want to respond to some of that. But I think that one of the conversations that we have had is around what if the outcomes of your research study is not as advanced as you had initially proposed because you're trying to work relationally? What are some of those ways of finding new ways of working that still has an outcome? Those are things that we will talk about. And that's why for me, Judith, the community of practice is going to be really critical. That once the 2023 projects have been granted, we don't want you just to disappear off and go and do your research and come back in 3 years. We want to meet fairly regularly, find out how things are going, whether there's delays in what you're doing because you're working in a new way. And we want to learn from each other in that way. So the community of practice that will start next year in around April, once everybody's funded and you're on your way, I think that's going to be really important. I want to just turn my attention into the chat from Dorothy and Abdullaya. Abdullaya's question, I think, Shreya, might be for you. Are there some indicators of relational well-being, the same way as there are of subjective or materialistic well-being, or just a proxy? So maybe I can ask you to address that in a minute or two. And then, Dorothy, from your group, there was a few questions about how do you measure relational well-being, which I think Shreya will pick up. But what about the relationship to social capital in the economic field? And contextually, the whole notion that, you know, has relational well-being always existed, or is it new, or has it existed in a different form or using different language? I think that's the question. And I think that that's important, that we think it has, but has it been codified in the way that White and Jar have done? No, not in that unique way, but is there other ways of codifying it? Of course. But I want to just talk about the notion of other theories. So social capital is one of them. But as Shreya was speaking about environmental indicators and relationships that aren't just interpersonal but are wider, you know, often in my head, I think about Bronfenbrenner's socio-ecological systems theory. And so a lot of people will say, oh, but how does those two relate? Well, those are really good fruitful spaces for exploring and widening and deepening this field, or saying, actually, we've already got some theory that will help talk about it, or no, we don't, because it doesn't talk about the multidimensional aspects of well-being. So these are all things that are, of course, are important and that you can explore. The wisdom of seeking, the wisdom and importance of seeking wisdom from other disciplines. I think Aline mentioned that a little bit, but I also can say that within the expressions of interest and the 80 projects that we have on the table, yes, many of them are in the social sciences, but some are coming from public health and from the medical field and a little bit wider and broader, and some have got multidisciplinary teams. And so we encourage that, but you do not have to try and bend and twist your proposal to fit what you think we want. We want everything. We want everything that is good and coherent and that will take us forward. And I think that was the one point that I made a couple of weeks ago, is what we don't want is people to just plaster a little bit of relational well-being on top of your own idea, because we can see it very clearly and very quickly. And this is not just a forum to find funding for a brilliant and beautiful idea that you have, but this is a forum for really investigating relational well-being in a way that has not been done before. And so, again, and I'm not putting people off from applying, right? I'm just trying to say to you, don't just plaster on a little bit of relational well-being, because then you would have wasted time in this application. We can see it really quickly, and that's not what we want. Everything else that we've been speaking about today is what we do want. We want originality, we want your voice, we want creativity, we want testing, we want philosophizing, we want empirical work, we want critique, we want so many things, and we want all of it in the 23 or so projects that we are going to be funding. Shreya, back to you.
So I'll just answer the questions on measurements. So there seem to be two sort of allied questions. Are there indicators for relational well-being? How do we measure relational well-being? Yes, there are indicators for the relational dimension of well-being. So again, I will emphasize the difference between the relational dimension of well-being and a relational approach to well-being, which is the model overall. Some of these indicators are already published in our earlier work. And again, I'm sure we can provide you with a list of papers which you can consult. There are, yes, the short answer to that is yes. Is it related, for example, to social capital in the economic field? I guess there are convergences and divergences between the two. Again, that's the short answer. I'm not going to get into a very detailed kind of comparison between the two. But again, I think a primary area of difference might be that social capital is again, is not an inherently relational concept. It's again about the distinction that I made earlier on as having relationships versus being relationally constituted persons. So perhaps that's the primary distinction that I will make. Again, I can refer you to papers that will sort of help you think this through a little further in the context of your own proposal.
Thanks, Shreya.
Yeah. Just to reiterate what Charlene said, is it a new idea? Does it already exist? I think it already exists. The idea of relationality exists, as I always emphasize. If you've been looking at sociology and anthropology, relationality is not a new idea at all. So I think certainly exists in some or the other way. How you choose to use it is entirely up to you.
Colleagues, are there any more concerns, questions, queries? I did see in the chat that there's a question about a budget template, and Dorothy has answered to say, please look at the application template. There are particular budget line items that are asked for. So no, not a template as such, but certainly line items that are requested. And then from the feedback point of view, both Dorothy and Patrick have confirmed that you should be getting feedback. And if you haven't yet got feedback, please drop a note to the Secretariat and we'll make sure you get feedback. We had 9 or so reviewers on each expression of interest. We had a moderating meeting. We had all of us sitting in that meeting. So there is quite a bit of feedback just to help you go forward. And some of it might just be careful of plastering on relational well-being to your other ideas. Some of it might be don't necessarily try and cover all of the thematic areas, right? We spoke about that last time we met, where some people were thinking, well, it'll be good if I use livelihoods and climate change and mental health and technological digitalization change. It doesn't make your proposal more impressive. It may make it more difficult to achieve. And so I think be very careful about trying to guess what it is that we're looking for, and trying to craft your proposal that towards what you think we're looking for. Because in a real sense, our scope is quite wide, as long as fundamentally it's about the relational well-being of young people, and working and gathering and thinking relationally. So I hope that's been helpful. Colleagues, I know that we've been on this call for 3 hours almost, and we've got 5 minutes to go. But I do want to thank you for the way in which you've engaged. Even though it's a difficult platform, thank you for the discussions that you've had in your small groups. Thank you for the questions that you've raised. Thank you for taking seriously my request at the beginning, that you bring questions and comments that will help the whole group of us, rather than just asking specifically about your own projects. But I do hope that there has been space to kind of ventilate some of your concerns about your own projects. And I hope you're feeling encouraged about both applying, but also not applying if you don't think it's a good fit for your expression of interest. And I hope that you're feeling included in the conversation, and that you're excited about helping all of us take this very exciting idea of relational well-being with young people forward. Yeah, I'm happy to hear some last comments, or just a note in the chat, or just maybe you want to put your camera on until the bandwidth drops, because many of us are in contexts where we don't have access to fast bandwidth. Yeah, so thank you, colleagues. Dorothy, any last words? Angelique, Candice, Aline, Shreya. Oh, thank you again, Shreya. We feel really privileged to have you part of our advisory group, and thank you for your participation today. It's been really great.
And for staying up a bit late and working past your work day. So thank you very, very much, Shreya.
It's not yet bedtime.
It's definitely past your working hours.
We'll see you tomorrow. Bring your coffee, bring your mate, bring your chai. I'm trying to be kind of culturally inclusive of all the drinks that we have. Bring your water. But don't bring your champagne, not yet.
Thank you very much.
Not
Thank you, everyone.
Thank you, everybody.
Thanks.
Bye.
Thanks, everybody.
Bye.